time. Hi, everyone, and thank you so much for joining us for this very first session of the 2020 virtual Fairfax County Public Schools Mental Health and Wellness Conference and Anova Act on Addiction Summit. We are so happy that you're joining us this afternoon for this really important conversation we're going to have to normalize mental health and to learn how to build tools for fostering success at home, in school, and really success throughout all of our aspects of life. My name is Jumi Olabanji. For those of you who I've not had the pleasure of meeting before, I am an anchor at NBC4 with News 4 Today. I am a proud Fairfax County Public School alum, the very first graduating class at Westfield High School in Chantilly, Virginia. And I'm so proud to be your moderator this afternoon for this keynote presentation, which is titled, Starting the Conversation, Recognizing Challenges and Sparking Dialogue Around Mental Health During COVID-19. Now, before I introduce our great panelists that we have for you this afternoon, we just have a few housekeeping notes that I want to point out. First, all participant lines have been muted and everyone's video has been turned off. So if you're looking at your screen, you're wondering why that is, that's part of the reason. This is how we wanted it. We will be taking your questions via the Q&A feature, which is located, if you're familiar with Zoom, right at the bottom of your Zoom feature there. So you could submit a question at any time, and we get to that part of the program, we'll try to get as many questions answered as possible. And then the last housekeeping note for you, just have fun, listen, take everything in, and like I said, please ask any questions that you have this afternoon. Now, to kick things off for this webinar series, we do have a short video from Dr. Scott Braband, the Superintendent of Fairfax County Public Schools, and Dr. J. Stephen Jones, CEO and President of Anova Health Systems.
Hello, everyone. I'm Dr. Scott Braband, Superintendent of Fairfax County Public Schools. And I want to welcome you to the 7th Annual Mental Health and Wellness Conference and Anova Act on Addiction Summit. I'd like to thank you for taking the time to be with us over the next 3 weeks, listening to and learning from our esteemed presenters and panelists who will provide you with valuable information on the topics of mental health, resiliency, and social awareness. Social emotional learning and resiliency have always been a focus in FCPS and are included throughout our Portrait of a Graduate attributes. Now, though, more than ever, we want to support our students in becoming resilient individuals who can overcome the challenges and adversity that are part of life, both currently and in the future. This year, we're pleased to welcome speakers from all over the country who will share information about how to have conversations with youth about their emotions, about how to foster social awareness through discussions about race and racism. Additionally, you'll have an opportunity to learn more about social emotional learning and how to embed these skills at home and across our FCPS community. Our final speaker will teach us more about resilience and how we can support youth as they learn to overcome challenging circumstances. We'd like to thank the Our Minds Matter organization for again facilitating the Youth Summit as part of the conference, and we express our sincere appreciation to Anova and Kaiser Permanente for partnering with FCPS on this important event. I hope you have a wonderful time learning more at this conference about all that this community is doing to support mental health and wellness.
I'm Stephen Jones, President and CEO of the Anova Health System. Today in our community, 65% of adults say they know someone who suffers from addiction or substance use disorder. And during these unprecedented and personally challenging times, 30% of us know someone who's had an even harder time dealing with addiction as a result of the COVID-19 pandemic. At Anova, we've seen this trend firsthand, and we know when it comes to addiction, it's just not enough to offer world-class healthcare. Success lies in a strong partnership with all aspects of our community, working together to address the challenges we face. That's why we're pleased that you are joining us today so that together we can act on addiction. Thanks to the generous support of Joan and Russell Hitt, last year we launched Act on Addiction, a campaign dedicated to raising awareness of substance use disorder, reducing the stigma associated with substance use, and providing our community, especially parents and young people, with tools and resources to get support for themselves or a loved one. While we could not have imagined then the challenges we face today, these times make us more certain, more than ever before, that greater awareness is needed for this important issue. We're honored to partner with Fairfax County Schools and appreciate their support to continue this important conversation about addiction in our community. Most of all, we're grateful to each of you for being here to listen and to learn.
We thank Dr. Braband and Dr. Jones for those great messages about the important work that we're all here to do this afternoon. Destigmatizing addiction and making recovery possible through accessible, personalized, and effective treatment plans is really the fuel and the reason why Joan and Russell Hitt made that generous gift to Anova back in 2018. A gift that is still giving its support through programs like this webinar series, aimed to educate and empower the community to take control of their mental health and to promote resiliency, especially in the face of adversity. I think we all know by now that 2020 could be labeled the poster child for adversity. In a recent study conducted by Anova, more than 30% of all adults and more than 50% of millennials in our community say they know someone who has faced difficulties dealing with alcohol or substance use disorder as a result of COVID-19 and this pandemic. Pandemic-associated issues such as job loss, stress, loneliness, these are all really big triggers for those who already suffer from substance use disorders or those who may be at risk. Not to mention the effects on, all the school-age children and young adults as they struggle to adjust in these new virtual learning environments that are so tough for so many. So what can we all do? What is being done? These are just some of the things our panelists are going to try to help answer. They have a wide variety of disciplines and situations, from a student to therapists and even some social workers. Today, our panelists will discuss the challenges of mental health support in COVID-19, the virtual world, and how they are working to overcome them from their various perspectives. The first panelist that I want to introduce this afternoon is Nathan Budo, a student representative for the Fairfax County School Board. There he is. Nathan uses his elected position as a platform to advocate on behalf of the increasing number of students within Fcps who are struggling with mental health issues. The next panelist that I want to introduce from FCPS as well is Kane, a resource counselor with the school system counseling services and a therapist with the Wise family. In her work, Casey supports children and families, allowing kids to build their own skills so they can regulate emotions, respond to challenges, and face each day with resilience and self-confidence. Next, on your screen, we have Mike Lovett, Counseling Manager for Anova's Comprehensive Addiction Treatment Services, or CATS program. Mike has broad experience in the realm of behavioral health, from complex trauma and art therapy to addictions treatment. And finally, also joining us from Anova, Joya Lee, a social work case manager for the Comprehensive Addiction Treatment Services program. Joya's extensive work with individuals who suffer from co-occurring mental health and substance use disorders has provided her invaluable understanding of the complex nature of substance use disorders and what it takes for people to maintain long-term sobriety. So thank you all for being with us. We're all excited to hear what you have to say on this very timely subject. And just a reminder to the audience, we do have that question and answer component coming up in just a little bit. So as you hear from our panelists, if you do have a question, don't try to hold on to it. You can put that in the Q&A at the bottom. We'll try to get all those answered. All right, so let's jump in right away. Nathan, if you don't mind, I want to start with you as the student representative here on our panel. School just started for you all. I think it was last week or the 8th or so. Goodness, I mean, virtual learning, we know distance learning, and having these conversations about things like your emotions and mental health, even race, which is a big topic here in our country right now. All of that can be challenging, of course. As a student, why do you think it's hard sometimes to have these conversations with young people your age?
I think that the problem is multifaceted, but I think the main cause of it is oftentimes because we're scared of being wrong, or we're scared that, our feelings aren't valid, because I think a lot of times there are sort of these, we feel as young people, there are these expectations placed on us whether it's by society or our families or whatever it may be. And because of these expectations that we feel that are being placed on us, we often are scared to, talk about our feelings, because what if they're not the feelings that we're supposed to be having? Or we're scared to have conversations about race, because what if that's not the thought that I'm supposed to be having? Or what if that's not the way I'm supposed to be thinking about it? And I think that this expectation that we feel to, always have conform to the right way of feeling or thinking or acting about something causes us to have, these, disconnects. It makes us not want to have these important conversations.
Yeah. Casey, if you don't mind jumping in, as someone who works in the school system and has conversations with students, do you agree with Nathan? And when students approach you with these sorts of conversations, what do you tell them?
I always hate going after Nathan because he's just so well-spoken and just so amazing. You're just the best. But yes, I think that, as a school counselor who started my career in elementary school, sorry about the background noise, my dog wants to have this conversation as well. I think that students often are fearful to have these conversations. And at elementary school, we teach them all feelings are okay. Don't be scared. Someone will listen to you. But too often they go to an adult and an adult doesn't listen. And so I think what's so important is for them to find that one adult, for them to find that there is someone in the community, and for teachers, parents, anyone in the community to show that they're willing to be that person, so kids aren't afraid to have the conversation.
Yeah. And Nathan, just to bring you back in real quick, why do you feel as a student, a young person, that talking about these things and these topics can be beneficial for your mental health and maybe, some of your friends who you've talked to and that sort of thing?
Yeah, no, I think it's extremely important. And here's why. When we start to talk and have these conversations, I mean, as cliche it is, it really does start to get better, right? I think that when it comes to race, and we're talking about, having the conversation about race that we're currently having as a nation, this country, it's about learning and growing and understanding what someone else is saying, or understanding what perspective they have or where they're coming from, and having that dialogue, opening up and having that conversation. It's about growth, personal growth, and growth for the people around you. And that same kind of thinking can be applied to that mental health aspect, right? When we start to talk about our feelings, we start to realize that we're not alone. There are other people out there who are feeling and experiencing the same things that we're feeling and experiencing. So I think that kind of validation that we get from opening up and talking, it's all about growth and, learning something new and learning something about yourself through other people. So I think that it's just the first step in that process is opening up and having these important conversations.
Yeah, well, which I think you're exactly right, and what part of what we're doing here today. Mike, Nathan touched on it. He said unprecedented times, and we hear that all the time here recently. And there's obviously no doubt that we're living in unprecedented times. And a recent survey there at Anova showed that 90% of adults here in our community report feeling negative emotions as a direct result of this pandemic. Fear, anxiety, stress, a big one. How important is it as adults, and especially as parents, how important is it to talk about these feelings with our children and just, even within ourselves and our friends and family in order to keep these conversations going and these lines of communication open?
Thank you for the question. I think that on a scale of 10, with 10 being the highest, I believe it would be a 10. I think that Nathan hit the nail on the head when he talked about emotional validation. We're all experiencing these feelings of anxiety, of fear, of uncertainty. And I think as adults, as parents, as people in leadership positions, that we need to model that. It's okay to be honest about these feelings and to be, open up that line of communication. And it leads to a feeling of unity rather than isolation. So I think it's critical, essential for that to happen.
Yeah, I would agree with that. Joy, to bring you into the conversation, are you seeing an increase in cases or even the number of patients that are coming to you facing these greater difficulties in life due to this pandemic? Oh, I think we might have lost Joy. We'll wait for her to pop back on. But Mike, maybe you can answer. We'll wait for Joy to come back on. But within the Nova system, are you guys seeing that increase in the number of patients and people coming in?
We absolutely. We have 10 groups going right now for intensive outpatient, which is basically a 10-week curriculum-based program that treats people with substance use disorder, also known as addiction. They're all full with a little bit of a waiting list going on. So we're seeing a big swell in the amount of people that we're seeing that need help to recover from addiction. Absolutely.
Yeah. Sticking with that, another trend that we're seeing throughout the community because of this pandemic, the stress, the difficult emotions a lot of folks are dealing with, more people are saying that consumption of alcohol has increased. Does that surprise you at all?
100% no, absolutely not. All the stress of economic uncertainty, certainly the social justice stuff, the COVID, all of that adds a lot of stress. People that are at work are working harder. There's different situations with their family. Um, our whole life as we knew it has completely changed. That creates a lot of stress, and with stress comes an increased desire to have some escape from that, which sometimes comes in the form of drinking.
Yeah. Thank you, Mike. Casey, wanted to bring you back in. We know that throughout these next couple of days, there will be two presentations during this conference that will focus on social emotional learning and resiliency, talking about, our young people, our students. How do you think that social emotional learning contributes to the development of a resilient child and a child who can succeed when going through tough times like we have right now?
Excellent, thanks. So social emotional learning is the foundation for resiliency. For those that social emotional learning is so broad, so I'll just give a quick, I could talk about it all day, but I know we're on a time crunch here. So I'll give a quick definition, but it's the process through which kids and adults acquire and effectively apply knowledge, attitudes, skills, all those things necessary to manage their feelings, set goals, problem solve, show empathy for others, take perspectives, and make responsible decisions. So if you have the ability to do those things, you have the foundation for resilience. You're able, when you learn how to solve a problem, you're able to persevere through a challenge. If you know it's okay to make a mistake and that you can manage that emotion and feel comfortable with that mistake and know that it's a learning opportunity, you're less likely to become stressed out or disappointed and reach your capacity. You'll have a higher emotional capacity for that frustration, like tolerance and things like that. And so really that social emotional learning pairs with resilience to help kids be able to navigate the world both in school and outside of school.
Casey, are there supports or a support system within the individual schools or entire school system for kids who are using substances? And what are those?
There are a bunch of different supports at the very, a first level of support. I think it would be your teachers and your counselors that may be the ones that are noticing changes in behaviors and the first ones to reach out. And then of course we have a whole countywide office, ATOD, alcohol, tobacco, and other drugs, that their job, their responsibility is to support schools with training, support students. There are employees in each of our high schools, and of course if the middle school or even an elementary school needed to reach out for that support, they specialize in working with students around alcohol, tobacco, and other drug usage. And so we really benefit from that collaboration throughout our schools, especially with the high schools, because kind of the resources are held there but trickle down as needed.
Yeah, sure. So Nathan, I want to ask you as a student, and I know you can't speak for every single student throughout Fairfax County Public Schools, but as a student, are you familiar with how to access help in school? And if not, if you think that's something that the school system can do better, what would you suggest?
Excuse me, I was on mute. I think it's a very important question, and I think it's a very interesting one. I'd say Fairfax County does amazingly well in finding ways to ensure that students know that there's support systems out there. It's interesting because every year, whether it be through our focus periods, through meetings with our counselors, or even signs that our teachers post on their doors or whiteboards, there's always ways for us to know what supports we have out there and what's available for us to get reached out to. But I think what's also interesting, another component of that, is now in this virtual setting, all of these problems still, exist. And in fact, they may be getting worse but there's not that contact there to have those supports for students. But the county has found ways to transition some of that SEL, some of that social emotional learning, into a virtual setting in a really interesting and effective manner. As someone who's got to sit on the board, I've got to see some of those higher level conversations about how they're going to do that, and it's been really, it makes me happy and proud to be part of a system that prioritizes things like that and is working to ensure that those support systems are still out there for students, even in the virtual setting. And as a student, it's been interesting to kind of see how some of the stuff is starting to get implemented. And I'm excited to see how some of that, continues to play out as the year goes on.
Nathan, thank you. So Michael, we've talked about the school aspect. What are some of the resources that are available to the community at large, or the general community, if you will?
For substance abuse treatment, there are quite a few resources. Obviously, Anova and Fairfax County have a wide consortium of services available, anything from the Fairfax County, there's the residential treatment programs, there's the outpatient programs, medication-assisted therapy. Similarly with CATS, we have intensive outpatient day treatment program, inpatient detoxification. We're fortunate in that we have a large community of providers around that work pretty closely together. Additionally, there's peer support groups, Alcoholics Anonymous, Narcotics Anonymous, Smart Recovery, Refuge Recovery, Celebrate Recovery, all of which focus on unity between people seeking a common solution and how they can support one another to stay sober. A little bit different formats depending on what people want, but we were very blessed in this area to have that many resources.
Yeah, and Michael, what can we do as a community, as families, as friends, to help kind of combat the stigma against asking for help, which I feel like a lot of people deal with, that, they just don't know how to, or they're embarrassed about it, or, how can we kind of push past that?
So true. I think education is this thing that we're doing here is huge with this type of thing. People do get embarrassed and ashamed about this, but shame, it can't survive in the context. There's a famous social worker named Brene Brown that says, shame cannot survive in the context of empathy. And I truly believe that, people are seeking understanding about this. There's a lot of information out there. People can learn what this actually is. It's not somebody recklessly trying to destroy their life. It's somebody that's struggling with something that's a very real problem for them. And I think empathy is the answer.
Yeah. And Michael, real quick, another question for you. Are these programs easy to find for somebody who's seeking the help themselves, or for a family member who wants to help somebody else out? Is it as simple as kind of getting on Google or getting on the Anova website and doing a search?
I think it's fairly simple. You click a button, you find the resources. Probably the most widely used thing is SAMHSA. It's a government website will show you every single location of a treatment center in an entire state. But similarly, if you just Google like Northern Virginia Blood Substance Abuse Treatment, you'll find CATS, you'll find Virginia Hospital Center, you'll find Fairfax County, you'll find so many different resources. It's just sometimes it's harder just to pick the right one. But I think a matter of awareness is, the most important, because a lot of people wouldn't know that.
Yeah. Thank you, Michael. Casey, I'm going to swing back to you for a second and get kind of back to the student and school aspect and conversation in this. So many parents have a child, multiple children who are doing the distance learning thing right now, just wrapped up that first week, heading into the second week, starting today. If they have a child who's maybe struggling, or they're worried about their child, what do you suggest that they do? Because we know that these are such hard times, especially for young people who are used to being in a building, being with their friends, and collaborating in person.
I'm a Fairfax County parent as well as a Fairfax County employee, and so I see both sides of the district. And I really think, again, going back to what everyone's been saying, that don't be afraid to ask for help. Don't worry that someone's going to say, oh, they're that parent. I don't even know what that parent is. Probably me. I don't know. But don't be worried about that. I've been talking, I talk to counselors, psychologists, social workers, teachers. We miss the kids. We miss the interaction, and we are here for you. And so the very first thing, any concern, there's nothing that's too small, pick up the phone, email, whatever, on every FCPS webpage, everyone's email, you just click on their name in the directory. We want to hear from you because we also are missing out on, like, in a school building, when you could see a student walking by, down the hallway, you could say, oh, they're walking in a different, they seem a little bit down. You can read that body language, and we're not getting all of that information right now. And so just asking for help. Again, if you ask one person and you're not getting the help that you need, ask someone else, because there's people, or at least a person in every building, that wants to support the family and the children. And I just want to tell everyone, you're doing a great job, because it's hard.
And Nathan, coming from the student perspective, what can your teachers, staff, counselors, administrators, adult community members, from what you've been going through yourself, maybe your friends that you've talked to, what kind of support do you all need? And, what can we all do to help you out through these tough times?
It's really interesting because I was texting a couple of friends, I think it was yesterday, and we were talking about how the one thing the virus situation, this whole pandemic situation has showed us is how much everyone, our teachers, staff, principals, counselors, and me, the people on the board and FCPS leadership team, how much they really love their jobs, right? I mean, we always knew that teachers teach because they enjoy doing it, right? But throughout all of the stuff that has been going on, there's been an excessive amount of outreach and, support, like I was talking about earlier, that, was still carried over. Because some of that, it's not even mandatory, right? You just see them going the extra mile. And I think that on its own provides this level of comfort in, if I have a problem, there are people here around me who are there to support me if I need it. So I just think that the extra mile that everyone seems to be going to ensure that students, are functioning in as comfortably and as best as possible in the virtual setting provides that space for students to say, these people really care about me. So if I have a problem, I can go and ask. At the same time, though, there's always, disconnects, between students and teachers and between kids and parents that always exist. And I feel like maybe in the virtual setting that exists a little bit more just because of the disconnect. So I guess it's all about finding creative solutions to, re-emphasize the fact that adults are there for students no matter what the scenario might be. And I think that starts with building connections with your teachers in the virtual setting at the start of the year. And I'm glad that the FCPS seems to be doing really well with that.
Joya, good to see you back with us. And so I wanted to bring you into the conversation so we could hear from you in your work with Anova, and knowing that there are people in these hard times, whether they're dealing with job loss, hours being cut, they've got the kids at home now, they're working at home, they're worried about a loved one, or they haven't seen family in a while. There's just so much that kind of compounds and maybe causes people to seek out more alcohol or any other kind of behaviors like that. If you have a friend, a family member, and you kind of see them and you recognize that they're kind of going in that path, in your experience, what's the best method to try to get them the help that they need without kind of putting too much pressure or being overbearing and to where they might push back?
Ooh, that's an interesting question. A tricky question, honestly, because it really depends on the individual that, you're working with. If that person is open, then I think you have a lot more options. Just having an open conversation with them at that point, if they're open to, listening. If the person is not ready to acknowledge that there may be a concern there, then I think it's a lot trickier. I think that being a supportive person is always important. But then again, if somebody's not willing to kind of listen, you're in a tricky spot. In terms of extreme substance abuse situations, if you're in that spot, you can always reach out to an interventionist. Sometimes, like you see on TV, those things really do happen. So, there are resources there. If it's kind of a life-threatening situation, you can always reach out to, Anova or your 911 ED situation. But ultimately, I think that just having open, honest communication is key, and kind of assessing the situation for risk, reaching out to your mental health treatment providers here at Anova, obviously, but your community services board, things like that. You can also reach out to your insurance providers. You can find options there as well. But I think just open communication is key, first things first.
Yeah, thank you. So now we're going to move into the question and answer portion. So we got some good questions that have come from some of our participants. And so we'll just kind of go down the line here. The first one I have here, this is Nathan, this is for you. Do you feel that most of the students feel the same way that you do? Or do you feel, or do they feel, pardon me, that their teachers don't always care about them?
Well, thank you for the question. And it's a tough question. I think that there's obviously something to be said about how someone's own emotions, perception influence the way they think about the feelings of other people. The way we view the world influences how we think other people view us. I think so. I think there's obviously, going to be, not every student will have the same opinion of the people around them that I have. And maybe my opinion's very rosy, in comparison to how other students might view the situation. But I would also add that I think that starts with trying to create the best possible environment. If this is a parent asking this question for your student at home, and showing them that they have the support there in their own household, just so that they start to feel, that positivity and I guess that support. And maybe they'll start to, kind of view that same support outside in the world, give them that space to do the same. And if it's not a parent asking the question, then I would just say that I don't know that every student feels the exact same way that I do. But what I do know is that if a student needs help in our county, there are resources out there to help them. And it's all about finding ways to match those students who need help with the resources. That's the tricky part.
Casey, let's, this next question, how about we start with you kind of answering, and then Mike or Joy, if you want to pop in. But this participant is asking, how do you reach out to children who might be reluctant to reach out for help? Are teachers and counselors able to be proactive?
Yes, so we are, before, we had an extra 2 weeks before school started. There was the original start date and then it was pushed back. And we really wanted people to use that time to reach out to children and families. People did listening tours where they invited families individually. So like teachers and counselors could really just learn about the family, learn about the students. Again, or school communities, they did it in that way too. And then individual one-on-one. I think the challenge does arise with the families that are disengaged for whatever reason. Maybe, they just don't understand the importance of, or are feeling overwhelmed, and having one more appointment to connect with the school is just too much. And I think that, again, like Nathan said, it's trying to find those creative solutions. So I have a colleague that sent postcards, good old fashioned postcards, to every single student that they support, because you can't ignore the postcard, right? It's going to come. You may look at it and say, hey, what's this? And so trying to think outside of the box for how can we communicate, because we do care, not just because it's our job, but because we love our job. And so people are really making that extra effort.
This is a good one, Joy or Michael, I would love for you to answer. Someone asked that, they say, I've seen a lot of ads about therapists and medicines and therapies, of apps and websites. Should I trust them?
I'll give a shot at this answer. I think it's be an educated consumer. Just because it's on Google doesn't mean it's true. However, if you go through the SAMHSA website, they actually list the resources that are legit, because for every good cause, there's a couple of people trying to exploit that good cause for other reasons.
Great. Casey, if you could answer this next one. How can we refer kids to the alcohol and drug program at FCPS?
I think in the very first step, again, is for if they're on the high school. So if you're a high school student or a parent, talk to the high school counselor. And then if it's a middle or elementary school, again, speak to the counselor or social worker or psychologist so that they can make those connections for you. We don't want to send you on a wild goose chase. So talk to someone someone in the school that then can quickly connect you to that resource.
Okay, thank you. Joya, for you, this participant says, I realize each situation and person is unique. What wording or how would you begin a conversation with the person that you see that is depressed or abusing drugs? Can you give me an idea or some verbiage to start the conversation?
Yes, I would start the conversation very gently, and I would use a lot of I statements and just express concern and love and, you know, empathy, and ask if there's anything that that person needs from you in terms of support, you know, how you could be supportive to that person and what they're going through. And then I would kind of leave it open and see where it goes from there. I think listening to the person is very important, actually really listening and hearing what they're saying and what they're going through. And then if you don't know the right answer or what to say next, you know, just continue to offer support and empathy, and, you know, encourage the person that you're going to help them get, you know, to the place that they need, you know, in terms of treatment or whatnot.
Thank you, Joya.
Mm-hmm.
Nathan, for you, this participant asks, what advice does Nathan have for parents about how to engage with their teens? What works best?
I would say the best way to engage is to first listen. I think that I'm hesitant to give this information because it makes it seem as if my parents and I have these perfect, open, awesome line of communication, right? No, I mean, I think as a teen, as a young person, it can sometimes feel like, as cliche as this might sound, your parents are living on a different planet. And like, I think I think the way to, you know, the way to bridge that gap is to listen. And it goes both ways, right? I mean, but I think if a parent's asking this question, I mean, maybe you can start the listening. I think that it's hard sometimes to understand what, you know, teens are going through, because the world that we're growing up in is so very different than the world that I feel like a lot of adults today grew up in when they were kids. So a lot of the problems, issues, and things that we deal with as young people are unique to our experience as young people. So trying to pretend like, you know, you have all the answers can sometimes kind of make it all worse. I think some of the best conversations that I've had with my mom or my dad are the ones where it's like, I don't have the answers for you, right? I mean, I understand what you're going through sucks, and I don't really know what I can tell you, but I'm here for you and we'll get through this. That kind of basis of accepting that, you know, I heard you, I get you, and you know what, I may not really have the answers for you. It really opens up, you know, the world for more dialogue, and it kind of builds that trust that if there's another issue that I have, you know, I can come to them because they're not out here shaming me or pretending like they, you know all the answers, but they're rather just understanding my struggles and willing to listen.
Yeah, thank you, Nathan. And yes, I can confirm the world you are growing up in is a whole lot different than the one I grew up in. Casey, if you could answer this next one from an attendee who says, if you think your child would benefit from connecting with their counselor or another mental health professional, but it's not a critical situation, how much should you push or encourage your child to, take advantage of those resources when they are available?
So I think at all times, kind of piggybacking on what Nathan said, that if you could be the first person as a parent to listen to your child and really try to just let them know that you're there. And just like Nathan said, don't try to solve the problem because you may or may not understand it from their perspective, but just let them know that no matter what it is, that you're there. And also they said if it's not, I think critical was the word they used, or to a kid, it may be. So I remember I often would get things about friendship and I'd say, oh, well, they're going to, be friends with someone else tomorrow. But to a third grader, or to anyone really, friendship is their life. So it may not seem like a critical problem from our adult perspective, but to that young child, it is their world. So there is no problem, again, too small. I would the parent can reach out and say to the counselor or whatever, the trusted adult, can you touch base with my kid? If it's an older child, older elementary even, we do want to promote self-advocacy, so encourage them to, you know, make those connections with adults. And I do know that some schools are offering, I can't speak for all 190 some of our schools, but some schools are offering like open lunches where kids can just go and connect. And so maybe that would be a nice, easy first step where they could just see that adult in a more casual, friendly way. And then from there, feel safer to be able to engage in a more personal conversation.
Thank you. So unfortunately, we're just getting so many questions, but we have to wrap up because we're running out of time. But real quickly and briefly, somebody had asked, you know, being online for school, that means limited physical activity. And a lot of times that physical activity just helps you feel good, stay fit, that sort of thing. So if you could each just real quickly, and Michael, we'll start with you, just tell us how you practice self-care and what you would suggest to do to just kind of feel your best in these times.
I think just making sure that what we can do, we do. Getting out for a walk, spending time with family. I mean, really having a dialogue. You know, for my family, we like the spiritual discipline, so we go to church. So I mean, just whatever you're working, make sure you make it a priority to engage in it and get off the screen every once in a while.
All right, thank you, Michael. Joya, what about you? How do you practice self-care?
I like to take a lot of walks with my doggies. I like to watch sunsets and actually reduce the screen time. I've done that this week on vacation, and you'd be shocked at how wonderful it can be to disconnect.
All right, thank you. Casey, what about you?
Well, you all heard my dog at the beginning of this presentation, so she loves to go on walks, so she's helpful for that. I also practice mindfulness, which is really helpful, and a random dance party is always a feel-good time.
Yeah, that's my kind of thing too. Casey, thank you. And then just lastly, you, Nathan, and I just want to let you know, we're getting so many compliments, people just saying how impressive you are. So I just want to let you know in case you haven't seen those comments, but we'll end with you, Nathan. How do you practice self-care?
Well, thank you. And I think for me, it's reminding myself that, you know, nothing's literally the end of the world. And I think that as far as stepping away from the screen, I do Peloton workouts. That's kind of my thing. I know it's corny, but that's how I guess that's, since I've been home and isolated for the past few months, that's something I've kind of taken up as aside from the athletics that I'm used to.
All right, Nathan, thank you. Michael, thank you. Casey, Joya, we appreciate it. Thank you to all of our panelists this afternoon. We really appreciate it. We know these are unprecedented times for all of us, adults, children alike. And the best tools we can arm ourselves with are resiliency, knowledge, and patience. We hope that from this short panel discussion and throughout this entire webinar series over the next several days, you all are strengthened by all three of these resources and more in strengthening the collective of our entire community here in Northern Virginia. For more information on the remaining webinars coming up or for resources on substance abuse and addiction, you can visit actonaddictionnow.org. And we are also putting this link in the chat right now. It just popped up, so you can check that out. We are also would be so appreciative if you could take a short survey that we put together. The link for that is also being put in the chat box right now. This will help us just kind of evaluate the sessions for this year and provide vital information so that we can shape next year's conference to be even better, whether that is in person or virtual, but hopefully it will be in person. Thank you all so much for joining us this afternoon, and we hope to see you at the next webinar. Have a great day.